Strokes are a leading cause of death worldwide, and for decades, the medical community's frontline defense has been a simple pill, daily aspirin. Aspirin thins the blood, reliably dropping a high-risk patient's chance of a stroke by 20 to 25%. But that protection comes with a dangerous trade-off, a significantly increased risk of severe hemorrhagic bleeding. A 25-year study following over 6,000 people recently identified an alternative, a daily habit that matches aspirin's 22% stroke reduction with absolutely zero risk of internal bleeding, using a simple piece of string. We usually treat dental care as maintenance for a closed system, mostly concerned with preventing cavities. But the vascular network in your gums is a direct, highly porous superhighway straight to your cardiovascular system. Finding a risk-free way to thin the blood requires looking past the pharmacy. It demands examining how microscopic daily behaviors block the creation of blood clots in the first place. In the late 1990s, researchers launched the Atherosclerosis Risk and Communities Study. They tracked the daily habits and health outcomes of over 6,200 healthy adults for nearly 24 years. This chart maps the baseline stroke risk for the participants against their hygiene habits. For the group reporting regular flossing, defined as at least once a week, the data shows a 22% drop in ischemic strokes compared to non-flossers. Those same regular flossers also saw a 12% decrease in their rates of atrial fibrillation, a dangerous irregular heartbeat. The most extreme protection appeared in a highly specific category. For cardioembolic strokes, strokes caused by blood clots forming in the heart, flossing provided up to a 44% risk reduction. The data revealed a clear dose-response relationship. The more frequently participants flossed, the further their risk plummeted. Researchers adjusted the data for age, weight, smoking, and even other dental habits to isolate the specific variable. The stroke protection remained intact. The benefit comes strictly from the mechanical act of flossing itself, independent of how often these people brushed their teeth or visited a professional dentist. The daily friction of dental floss operates as a primary defense system for your heart and brain, mechanically severing the link between oral decay and fatal blockages. How does microscopic debris trapped inside the mouth physically reach and damage the heart and brain? When plaque and food particles sit undisturbed in the tight spaces your toothbrush can't reach, they cause localized gum disease. The immune system detects this decay and mounts a persistent, systemic inflammatory response to fight it. Pointing out the mechanism, here we see that localized inflammation spreading from a gum pocket directly into the adjacent blood vessels. Blood tests from the study revealed that non-flossers had elevated levels of interleukin-6, a key biological marker confirming that inflammation has flooded the bloodstream. As those inflammatory markers circulate through the body, they actively degrade blood vessel walls. This accelerates atherosclerosis, the hardening of the arteries, and directly inflames fun muscle tissue of the heart itself. That persistent low-grade cardiac irritation acts as a physical trigger for atrial fibrillation. The electrical signals in the upper chambers of the heart begin to misfire, creating a dangerous, erratic rhythm. Because the heart is no longer pumping smoothly, blood begins to pool and coagulate. A clot forms, breaks loose, and travels straight up into the brain, causing a deadly cardioembolic stroke. By manually sweeping away the bacteria that triggers the immune response, you stop that lethal chain of inflammation from ever entering your bloodstream. If you have spent decades ignoring this habit, the biological damage is not permanent. The tracking data explicitly demonstrated that picking up the habit later in life still yields significant, measurable drops in stroke risk. Whether you start in your 40s, 50s, or 60s, the systemic inflammation begins dropping the moment the plaque is removed. Compared to any medical intervention on the market, the cost-to-benefit ratio here is unmatched. You're securing pharmaceutical-grade cardiovascular protection for pennies a day. Systemic inflammation causes blood clots, and those clots cause strokes. Flossing mechanically removes the deep bacterial decay that fuels that inflammation, cutting the specific risk of a cardioembolic stroke by nearly half. You don't need a prescription, and you don't need a doctor's appointment. You can take immediate, zero-risk control of your cardiovascular health tonight, right at your bathroom sink.